So I'm going to be straight with you. You really need functional medicine to help with your symptoms. You can fix this, but not with traditional medicine. In phase one, traditional medicine thinks everything's fine, blows your symptoms off to normal aging. Maybe they will offer you a sleeping pill, an antidepressant, an anti-anxiety medication to ease your symptoms, but they don't deal with the massive fluctuations of hormones. They just mask symptoms. They don't have the right tools in the toolbox. In phase two, when you're having wonky cycles and symptoms of crazy estrogen, heavy periods, absent periods, oscillating, they'll either offer you birth control pills or a hysterectomy. And in phase three, you're kind of out of luck because most doctors are afraid of hormone therapy, even though they're looking at antiquated studies that say hormones are dangerous, because the newer data that we have, properly done bioidentical hormone replacement therapy is safe and beneficial. The traditional medicine doctors haven't adopted that yet. They're still afraid of hormones. So what do we have to offer you? Well, one, hope. This is temporary. There is treatment. You do not have to suffer through this, and you certainly shouldn't have to suffer for 15 years. In phase one, we work on cleaning up the gut. Let's eat fiber. Let's promote healthy gut bacteria. Let's avoid glyphosate. Glyphosate is Roundup and it torches your microbiome. And it's like machine guns killing all the good guys. And if you don't have healthy gut bacteria, you can't metabolize your estrogen. Also in phase one, stress reduction. We do not want to be promoting cortisol steal. We need to improve our ability to reduce stress. Now in phase two, where your hormone levels are fluctuating and your estrogen levels are dropping some, this is a time to consider hormone replacement therapy, but you really need testing. Don't let anyone guess, like I did the first time, and try to treat estrogen dominance by just adding progesterone. Get the testing done. We need to know your hormone levels, all of them. We need to know insulin, thyroid, cortisol, estrogen, progesterone, testosterone. We need to know your micronutrients because your micronutrients are the cellular machinery that allows your body to respond to the hormones. And if you don't have enough vitamin D, you're not going to respond to hormones well. And if you don't have enough B12, your moods aren't going to be stable. And one of the symptoms of perimenopause is mood instability, but it's also a symptom of B12 deficiency. So let's make sure we give you a fighting chance by giving you optimized micronutrients. Number three, let's heal those hormone receptors. If we can help the cell membranes heal, then you have healthy hormone receptors, and that gives your hormones a fighting chance to be able to lock into that receptor so that the key fits into the lock and we can unlock the door to energy, clear thinking, and stable moods. Lastly, we really need healthy fats. That is what helps to heal the locks. It's like lube for a rusty lock. Fats get oxidized by toxins and it melts them like melted plastic. And we need to remove the flamethrower, get rid of the inflammation that's damaging the fats. We also need to rebuild healthy cells. And in order to do that, we need to have healthy fats. So what is healthy fat? Well, certainly nothing that starts with partially hydrogenated. Avoid that like the plague. Healthy fats are from raw nuts and seeds. Omega-6 and omega-3 fatty acids in their natural form are the structure of your cell membrane, and they need to be from healthy food. A lot of people are talking about omega-6s as if they're bad, and I'm here to tell you I disagree 100%. Omega-6s are not inherently bad. Did you know that breast milk has a 4-to-1 ratio of omega-6 to omega-3 fats? Why would God do that if omega-6s were bad? They're not. Your cell membranes have an omega-6 to omega-3 ratio of 3-to-1. The problem is we're eating rancid fats. Have you ever bitten into that walnut and it has that awful taste and you just cringe and you spit it out immediately? That's rancid fat. Those rancid fats go to your cell membrane and they don't help with the rusty lock. So these vegetable oils that are industrial seed oils like Wesson or canola, rancid. It's not that the omega-6 is bad, it's that we're eating unhealthy omega-6s. So the omega-6s from raw nuts and seeds are not rancid, and that's what your body needs to heal. The treatment for phase three, number one, stress reduction. There's a little theme here. Stress reduction and toxin elimination is in all three because that's how it crosses all barriers and borders, and it's so pervasive that it messes up the way your body functions. Also, in phase 3, really have a hormone replacement therapy conversation with someone who understands how to do bioidentical hormone replacement therapy. Now, if you're not fully menopausal yet and your body might still occasionally make its own estrogen, you need to work with someone who understands how to balance that. Because if you just try to go on a one and done hormone replacement therapy regimen, and then all of a sudden your body kicks in and makes its own hormones 1 month every now and then you feel kind of out of whack. And if you're not with someone who understands that, then you end up with this major workup for what they would call postmenopausal bleeding, but it's not really. It's just that your body made its own hormones again. So there are ways around that, but you need to work with someone who understands those intricacies. And the key to safe bioidentical hormones is 3 factors. Use the right hormones, which means the right keys. They have the right shape. They're bioidentical, which means molecularly identical in structure as to what your ovaries used to make. Number 2, please balance them. Traditional medicine doesn't check hormones once it puts you on hormone therapy. It's not part of what I was taught. I was so embarrassed, but I had to go outside of my OBGYN training to learn how to evaluate hormone levels in women on hormone replacement therapy because it matters. We want to look at estrogen and progesterone in balance. And then number 3 for hormone safety is make sure you metabolize the hormones down a safe pathway. And that is crucial because there is a happy way to metabolize estrogen and an angry way, an unhappy way. And the unhappy way is something that some people are genetically predispositioned to that. And unless they do the testing, they wouldn't know it. But there are things we can do to encourage and push it down the healthy pathway because we do not want to have risks for hormone therapy. And if we use the right hormones in the right balance and make sure we're metabolizing them safely, you get all the benefits and you minimize the risks. Bottom line, perimenopause is temporary, should not be 15 years. If that's the case, please seek help. If you're told that there's nothing that can be done, and just take a birth control pill, get a second opinion. This time of your life does not have to be so much of a struggle. It shouldn't be that hard. There is hope.